Good morning, my name is Reverend Bob. I'm here to start our fundraiser, Brunch for a Cause, to benefit Good Shepherd Hospice. I've been a hospice chaplain for 16 years and I've had many experiences working with our families, including their pets. I've been on both sides of hospice as a chaplain and also a recipient of the services of hospice. I lost my wife 2 years ago on hospice, and I've seen and appreciate the compassion and the work that the whole team does, from the doctors to the nurses, social workers, chaplains, and aides. My wife passed away in our home, very peaceful, very comfortable, thanks to the whole team. I'd like to say a prayer for this fundraiser. Loving God, may I be your hands and feet today, bringing comfort, healing, and care. May I speak with your love, bringing hope, understanding, and kindness. May I carry your peace in my heart, bringing charity, reassurance, and calmness. May each moment be filled with heavenly truth. May each moment be filled with your love. With you, I'm stronger, kinder, and wiser. Come lead me through each moment and watch over my working day. Amen. I'd like to give a blessing to all the donors and to all the supporters of hospice. It reads as follows from the Old Testament. May the Lord bless you and protect you. May the Lord make his face shine upon you and be gracious to you. May the Lord bless you with his peace. In his precious name, amen.
Good morning, everybody. Thank you for joining me for our Good Shepherd Hospice Brunch for a Cause. And thank you, Reverend Bob, for our greeting and starting us off this morning. I'm Kim Kranz. I'm the president for Good Shepherd Hospice and Catholic Home Care. And I first want to say thank you. Thank you for joining us this morning. I think we're all ready to get out of our homes and be in person and be together where we can enjoy this event. And I know that you wanted to be a part of this from the very beginning. We had a great amount of people joining for the brunch right from the beginning. And although we're doing this virtual, I will try to bring to you as much information as I can about what's been happening here, what's going on, and also to make sure that you know that what you're doing for us and being a part of this truly helps us in our mission and in our service and continuing to serve patients throughout Long Island and our community. So COVID-19, right? Lots has happened, and I will tell you, and it's quite remarkable. at first people might be a little concerned. We did have an increase in our hospice needs and hospice care. And I think what we realized very quickly and why we wanted our elderly to be protected is because the virus could affect people who are older, who have chronic illnesses, and we did take care of patients also with the virus. But we also saw a really, I'm going to say a beautiful shift. A shift in that people wanted to be at home. People didn't necessarily want to go to the hospitals during this time, especially when they were seriously ill, and they wanted our expert care. So what we did see is more referrals come from our physicians and even from our families so that we could best serve them in the comfort of their home. With the coronavirus, obviously, and this was, the big thing that you heard on the news, was about getting enough personal protective equipment. It was donors. It was our universities. It was everyone throughout the Long Island community coming to us and helping us to be able to get personal protective equipment. And so that helped us protect our patients, protect our families. And we're in a really unique situation with Good Shepherd Hospice because we know who's coming to us. We get admission information ahead of time. We work very closely with the hospitals and the physicians so that we knew if someone was infected, and we could also protect other patients and families who were concerned with us going into their home. So there was no stopping our services. As a matter of fact, we saw the need for hospice increase. And even home care increased very quickly right after the virus had broken out in April and May. So I will say that I'm pleased that the staff, volunteers, donors, everyone really came forward to support us during this time. And I can't tell you how appreciative we all are, all the employees at Good Shepherd Hospice, so that we could continue this great mission. And now I would like to introduce a very, very special video that we had the honor of filming together with the Alvarez family. This is Lou Alvarez's story. We had the honor of taking care of Lou when he needed our services on hospice. Lou was cared for in our Mercy inpatient unit at Rockville Center. And I hope you recognize Lou Alvarez's story. He worked tirelessly as a first responder for 9/11 and worked tirelessly to make sure that his other fellow first responders were taken care of based on the effects of 9/11. And we saw him on World News. And again, we had the honor of working by his side. And next, I'd like to share this video with you, showing you Lou's story. I want to also thank the National Hospice and Palliative Care Organization for coming to us to film this. As part of Lou's story, this film has been utilized all across the United States of America, showing what hospice services is all about. Thank you.
I called him on the way down and asked him not to go down. I was afraid, but he didn't hesitate. He said, I'll be fine, it's what I have to do and it's what I want to do. My brother was at Ground Zero for 3 months.
He was there for 12-hour tours, and we have incredible pictures of him with his whole unit being down there and just doing anything they could. There was no other place he wanted to be. And he also said that even if they told us the air was bad, or as bad as it was, we would have still been down there. As he started his treatment, he would get on his phone and start blogging. And chemo treatment number 1 became chemo treatment number 10, became chemo treatment number 25. And he would always put something to encourage fellow officers to get checked out.
I should not be here with you, but you made me come. You made me come because I will not stand by and watch as my friends with cancer from 9/11, like me, are valued less than anyone else because of when they get sick, they die.
From everything they offered for my brother's comfort, both, physical comfort, but also, emotional. My brother was most impressed with the first consult with the doctor. He said he was in here for over an hour and almost a half, and not talking just medical stuff. He wanted to know what my goals were. He wanted to know what I wanted, the end to be like.
We really created the space to allow him to be him. Baseball cap, kids at the bedside, mom bringing in food.
We are finding with the 9/11 responders, they are younger patients with younger families. So there is a balance that's trying to be met between taking care of a patient, and let's say it's a wife taking care of her husband, and then at the same time trying to get the kids off to school, keep their life as normal as possible.
Our model embraces the wholeness of life, our ability to listen, to best understand, and meet that person and meet their loved ones where they are in this journey.
Detective Lou Alvarez. Many detective would have thought after your testimony on Capitol Hill, where you spoke so eloquently and passionately, that could have been it for you and your message, especially after the news you got the next day. And yet, you're doing a line of interviews, pushing yourself to the limit, really. Tell me why.
Because the bill hasn't passed yet. And that's my ultimate goal, legacy, is to have this bill passed so first responders have the coverage that they need.
We wish he could have been around to see it signed. We were there for the congressional vote. We were there for the Senate vote. We got to meet with our leaders in Washington, all because, my little brother just wanted to do the right thing for others.
So a lot of times when someone comes on hospice that has gone through the tragedy at 9/11, we can't tell them that they have to give up fighting. We can't tell them that they have to give up hope. It's just that hope is in something different, and that fight is for something different.
I'd like to also acknowledge that Lou's family, Phil Alvarez and other family members are here with us today, and I want to say thank you for joining us, and thank you for being a part of our brunch and a part of Good Shepherd Hospice. Next, I'd like to introduce Dr. Carrie Ann Page. Dr. Page is our Chief Medical Officer for Catholic Health Services, Good Shepherd Hospice, and Catholic Home Care.
Thanks, Kim. Good morning. I'm here in the kitchen at our inpatient unit in Mercy Medical Center, and I'm thankful that all of you have joined us this morning. If you're like me, You find Lou's story incredibly moving and powerful and emotional. It reminds me that all of our patients have goals and dreams and things they want to accomplish. We were very fortunate and honored that we were able to care for Lou and his family and to help him in his quest to see the legislation that he championed become reality. Many of our families and patients have goals that are less public, but are very important nonetheless. They include things like seeing the birth of a baby, being present at a wedding, or being able to be home amongst family and friends and the people that they love. The role of hospice is to help make those things happen and to help people live as fully as they can when their life expectancy is limited. Through the work of our physicians and nurses with their specialized training, we are able to provide symptom control so that people are able to focus on the things that matter to them most. The emotional and psychosocial and spiritual support of our social workers and chaplains and volunteers provide an additional layer of support for both the patient and their family to help them cope and manage through the last days of an illness. The support of our community of donors is incredibly important to helping us do this work and also to spreading the word about the importance and value of hospice care for people with limited life expectancy. You may not know that we also provide services for people throughout the course of a serious illness, not just at the end of life. Good Shepherd Hospice provides palliative care services in our CHS hospitals and through our home-based symptom management program. Through these services, expert medical care and psychosocial support are available to people living with a serious illness. This kind of support ensures people's symptoms are attended to, that they have support for planning and decision-making. It enables patients to tolerate treatments better and helps support people on their journey through an illness. Through our Gabriel's Courage program, we provide perinatal support and planning for families with endangered pregnancies. That service provides support before the birth, during, and after the birth to help the family in this very vulnerable time. And we provide support for families who've experienced the loss of a loved one, whether or not they've accessed the services of Good Shepherd Hospice. Our community bereavement services provide both individual and group support and education to all Long Islanders who've experienced a loss. Those services are exceptionally vital in this time of the COVID-19 pandemic and have provided an incredibly important resource for our community. All of these services may not necessarily be reimbursed by medical insurance or may not be fully covered by medical insurance. And so it is the support of donors like you that make it possible for us to continue to provide the high quality care that we do to patients and families across Long Island. I thank you very much for your support and ask for your continued support as we work to further our mission to provide this kind of care to all Long Islanders. And now, I'm very happy to introduce you to TJ Tana, our illusionist, who provides some entertainment for us this morning.
Thanks, Dr. Page. Hey, everyone. Thank you so much for being here, and thank you, Dr. Page, for that wonderful introduction, and thank you for all of the things you do for Catholic Health Services. We really appreciate everything you do. You know, my name is TJ Tana, and I'm a magician. I'm actually the interactive illusionist, and right now we're going to have some fun. Now, we had some people in our virtual audience, but right now you at home are going to get a front row seat to my brand new virtual performance show right here, right now. Now, I'm a magician, right? And I'm performing for a camera. So perhaps what you're about to see tonight, you might even think could be a camera trick. Let me show you something that is not. I assure you, everything you're going to see here is exactly as you would see it if you're at home or if you're here in person. Check this out. I'll show you something quick with some money. This is very slow. I'm going to get really close to the camera so you can see this. That's 1, 2, 3, 4, 5 $1 bills. You at home, don't take your eyes off the $1 bills. That's 1, 2, 3, 4, and 5. Watch the money. I'll do this as slow as I possibly can. People often ask me as a magician, how do I make money as a magician? Well, you have to hypnotize the people that you're giving the money to. See, there's the ones. But if I shake it, it's going to look like they begin to change. If I snap and actually turn them like this, you can see the moment the bills actually change. Every single bill changes into a $100 bill. But don't worry, it's just hypnosis. You see, that's $100, $200, $300, $400, $500. The hypnosis is real, folks. But if I just snap my fingers, you see the moment the hypnosis changes from hundreds back into ones. And that brings those hundreds back to ones. And the question I ask myself continually is, why do I turn the hundreds back to ones? I don't know why. Hey, listen, we have an incredible virtual audience with us today. I'm going to invite a couple of people into the chat right now. I'm going to go ahead and bring somebody in here at total random. We have about 5 people here, and I'm going to bring in Talissa. I'm going to ask if you can help us out. I'm going to ask to unmute you. I'm going to bring you into the spotlight here. Talissa, can you say hi?
Hi, everyone.
Hey, how's it going? Thanks for being here, Talissa. Where are you coming from?
I'm in New York.
New York, fantastic. Are there any new skills that maybe you've acquired while you've been, just hanging out at home?
I have been trying to learn sign language recently, which has been kind of fun.
That's good. That's good. I've been trying to cook in the kitchen. I've been learning new magic tricks, and I've been trying to solve Rubik's Cubes, but that hasn't been going so well.
Awesome. Oh, really?
But we're going to try something right now, Talissa. You and I, you're going to be the eyes and ears of the audience. Are you familiar with playing cards?
Yes.
Perfect. Here's what's going to happen. I'm going to show you a couple of playing cards, and I'm going to give you 5 seconds to memorize as many things as you can about them. Just going to give you 5 seconds. I promise it's an easy test. Most people do well. Are you up for the challenge?
All right, let's do it.
Perfect. Here we go. 5 seconds on the clock. Here we go. Starts now. 5, 4, 3, 2, and 1. That's all you get. My first question, Talissa, is how many cards did I have?
5.
5. Very good, very good, very good, very good. That's good. Most people don't get that. That's good. Okay. Second question. What was the card on the bottom of the face? Do you remember the card on the bottom of the face?
The blank card?
Ooh, so close. It was actually the Ace of Spades. That's okay. That's okay. I know it's tricky. How about this one? How about what color were the backs of the cards?
It was red.
Red. Ooh, I'm so sorry. They were actually all blue. Every single one of them was a blue card. Yeah. And if you missed the blue backs, you probably missed the entire royal flush.
What?
And you know what's crazy? If you missed the royal flush and you missed the blue backs, you probably missed the moment when I solved my Rubik's Cube. Every single side of the cube, 100% solved right there. And that is the face of astonishment. Hey, Talissa, thank you so much. That was amazing.
Thank you.
You're welcome. All right, we'll see you in a bit, Talissa. Thanks for helping out. Oh, man, that was unbelievable. I'll show you a few other cool things here. Again, I was talking about magic and perhaps using camera tricks. I promise everything you're about to see is real, just like you would see in person. Like this card, for example, the 3 of Spades. What's interesting, if I take the 3 of Spades and hold it near the blue light, it looks like the color blue, and it is the color blue. But if I take that very same 3 of Spades and bring it close to the red curtain, it changes to the color red. It's strange. It almost looks like a camera trick, but it's not. Let me try one other for you. This one will be really cool. This is the King of Spades. You can see a hole right through the King of Spades. You can see my eye right through the King of Spades. You can see my finger go right through that hole. But don't always believe what you see. Although you saw the hole before, it wasn't a hole at all. You see, that hole is just a sticker in your imagination. And that hole was never there to begin with. That is a whole card. It's kind of wild. I don't know how to explain it. I thought maybe I'd do something that I don't typically do. I'm going to teach you guys how to do a trick at home. Here's how we're going to do this. I'm going to show you the trick first, and I'll teach you exactly how it works. So for those of you who are at home and you might have these objects nearby, you can perform this trick too. It's the mystery of the red handkerchief. Check this out. I'm going to poke the handkerchief down into my fist. Watch. I snap my fingers. I say the magic words. Catholic Health Services, and just like magic, the handkerchief turns into an egg, and the handkerchief is gone. The secret is very simple, okay? It's probably more simple than you think, is just a fake hollowed out egg. Matt, you look upset. I'm so sorry. You thought it was going to be real magic. No, very simple, easy to do, nothing crazy, just a fake hollowed out plastic egg and a handkerchief. That's all you need. Once you have those two things, you can become a magician. But let me walk you through the actual trick. So you start with those two objects. You show your hands empty, you reach into your pocket, you reach into your magic case, you take out the handkerchief, but you're also going to take out the fake egg. Nobody knows about this, okay? So you want to conceal the fake egg inside your hand. Then you take the handkerchief and you begin to poke it down into your supposed empty fist, but really you're poking it into the fake egg. And then you poke it all the way in, and then you snap your fingers, you say your favorite magic word, you wave your hand, you show the handkerchief turn into an egg, you take a bow, and the audience gives you a big round of applause. It's that simple. But there are a couple of tips, okay? Tip number one, make sure the audience is always in front of you, never behind you. Obvious reasons. But if the audience ever sees this side, trick is over. It's bad. It's terrible. I can't help you there. But there is one solution. You can take the egg, give it a slight wiggle. You snap your fingers. You can slowly peel the hull off the egg. And if you get really good, you can take that fake plastic egg and turn it 100% real. Cheers, everybody. No, just kidding. Oh, man. Don't tell anybody the secret. It's very important. I want to end with one last thing, and I'm going to bring a few of our guest members here into the virtual audience here. I'm going to go back. I'm going to bring back Matt here. Matt, you're going to come back in, and you can unmute yourself. We're going to bring in Lily. Lily, you can come on in here, and we'll bring in Talissa also. Come on in here. Perfect. Hey, everybody. You can go ahead and unmute yourselves. I will ask to unmute everybody. If you're there, you can say hello.
Hello.
Perfect. Thank you so much. We're going to try something right now that I think you're going to remember for the rest of your life. If you have a cell phone, I want you to take your cell phone out right now. Go ahead, take it out, and I want everybody to open to their calculator, probably the most underused app of all. Open to your calculator, and we're going to try something right now. We're going to make a number. Or some of you have Androids. Smart. Matt, you got a phone too handy? Perfect. Take it out. Let's see the calculator on there. Perfect. Now, and also, if you're at home right now watching this, I want you to take out your calculator too, because this is going to happen on your phone also. So let's try this. Let's create a random number, a number that we could have never even thought of. I'm going to start with Lily. Lily, can you just give me any number between 1 and 100? Doesn't matter.
72.
72. I want everybody right now to type in 72 into your calculator. Here in the audience and here at home, type into your calculator 72. Perfect. And then we're going to press, let's do multiply. Everybody click multiply. 72, multiply. And let's go over to Talissa. Talissa, I want you to go back in time, and I want you to go to, do you remember the home that you grew up in?
Yeah.
Do you remember the house number?
Yeah.
I couldn't know the house number.
No.
I never asked you for the first time. What's the house number that you were thinking of? What is the house number?
1740.
1740. So let's type in right now 1740. So we're doing 72, multiply 1740. Let's keep going. Everybody press multiply again. And that should be now our new updated number. Everybody should have that. I'm going to go up to Matt. Matt, can you give me a number? Do you have, this is an interesting question. Is there a time, a specific time of day that might be very important to you? Any time of day. Maybe it's the time that you were born. Maybe it was the time that something amazing happened, a time you won an award. Any time of day, it doesn't matter.
3 o'clock.
Exactly 3 o'clock.
Exactly 3 o'clock.
Okay, so let's do 300. That would be the 3 o'clock. So let's do basically 300. So 300. Type that in. Perfect. Let's press multiply again. That's 3 numbers. Let's get another number here. We'll go back down to Lily. Lily, here's a crazy question. I want you to think, I want you to give me the number. I want you to give me the age you were when you had your first kiss. Think back.
13.
13? Perfect.
Yeah.
We pressed multiply. Let's type in 13 right now. 1, 3. Perfect. Let's hit multiply again. And let's get another number here. We really want to make this big and random. And if you're following along, this should be the number you're looking at. Everybody's looking good. Very good. Perfect. And let's go back to, we'll go back to Talissa. Talissa, how about you give me a number? I don't know. Give me a random number. Give me a number between 1 and 100.
26.
26. Okay, so we press multiply. Everybody put in 26. Perfect. And let's press equals and see what we get now. Press equal, get a big number. Let's do one more number. Let's all press the plus button. We'll add one more big number. Everybody press plus. And here's what we're gonna do. Matt, I'm gonna use you. Matt, I'm gonna hold the phone face down and I'm gonna take my finger. This number is gonna be random. I'm gonna start poking my finger on the screen. I'm not even gonna look. And I want you to tell me when to stop whenever you want.
Stop.
Are you sure?
Yeah.
Did I get a bunch of numbers?
Yep.
I did? Okay, perfect. So let's do plus. Ready, type plus, and let's put in this number here. It is 27451 612 100. And everybody, let's press equals right now. And that should give us a new number. Does everybody have this number? Perfect. And you might have to hold your phone sideways depending on what phone you have there. Perfect. So that's a big number. There's no way we could have known that this is going to be the number we would land on. But here's the thing. What if I told you I knew that this was the number we would have? I'm going to show you something here. I'm going to tilt the camera down just a bit. I'm going to place my phone right here in full view the entire time. And if you're following along at home and you have the same number, this will be impossible. You see, I've had this envelope here the entire time, and I have not touched it. And in this envelope, I did write down one number. One piece of paper. Again, I couldn't have imagined the numbers we were going to get today. They have been all random. Nothing has been set up. I'll open this slowly and take a look at this. The number exactly matches 40155004100, the exact number on our phones right now. It's amazing. But I want you to take this back full circle, because remember, I told you there was a few important words about this evening's performance. And one of those words was compassion. And perhaps after this performance and after this virtual event, you might feel your own compassion, and maybe you'll want to donate to the cause. And sometimes you have to look at things through a different lens, through a different perspective. You see, the number we created today, it had to be. It was meant to be. Because this number upside down is the word compassion.
No way.
Yeah. That is the word compassion. That is the word of today. And you guys have been an unbelievable audience. Thank you all so much for being here. And thank you to everybody at the Catholic Health Services, Dr. Paige, Marianne, everybody who helped put this together, Victoria over at the Video Services. Thank you very, very much. And thank you to all of you that helped us out. Lily and Talissa and Matt, thank you so much. I'm going to go ahead and let you be. You guys have been an unbelievable audience. I have been TJ Tana, and I hope you enjoyed my virtual magic performance. And if you're interested in bringing this virtual performance to your next event, you certainly can. I will be available to do virtual performances anywhere at any time, and you can get in touch with me here at tjtana.com/virtual. Thank you so much, Catholic Health Services. Thank you for having me. Have a great day. Thank you so much, guys. See you soon.
Thank you, TJ, for that thrilling performance. I'm Courtney from the development team here at Good Shepherd Hospice, and I'm joined here today with Diane to help bring our event to a close with a raffle drawing. All donors have been entered into our bowl of tickets, which will be tossed around after each winner is called. All winners will be contacted following the event. Now let's begin with the first prize. The winner of basket number 1, Family Staycation, is Alexandra O'Reilly. Congratulations. The winner of basket number 2, Now That's Crafty, is Michael Baldini. Congratulations, Michael. The winner of basket number 3, Date Night Essentials, is Charlene Valentino. Congratulations, Charlene. The winner of basket number 4, Family Fun Pack, is Kathleen Ganley. The winner of basket number 5, Boss Lady Goodies, is Denise Ingerman. Congratulations, Denise. The winner of basket number 6, Day with the World's Best Grandparents, is Carter McGowan. Congratulations, Carter. The winner of basket number 7 for the Coffee Lovers Home is Denise Ingerman. Congratulations, Denise. The winner of basket number 8, Diva for a Day, is Jim Butler. Congratulations, Jim. The winner of basket number 9, Night Out on the Town, is Sister Patricia Koehler. The winner of basket number 10, Birthday in a Bag, is Kim Kranz. Congratulations, Kim. The winner of basket number 11, Athlete in Training, is Phil Alvarez. Congrats, Phil. The winner of basket number 12, Dine Around Town, is Maribeth McKeever. Congratulations, Maribeth. The winner of basket number 13, Make a Splash, is Matt Hetterich. Congratulations, Matt. The winner of basket number 14, game night, is Barbara DeMarco. Congratulations, Barbara. The winner of basket number 15, relaxation time, is Stuart Almer. Congrats, Stuart. The winner of basket number 16, the wait is over, is Rebecca Contoro. Congratulations, Rebecca. The winner of basket 17, fitness fanatic, is Kim Kranz. Congratulations, Kim. The winner of self-care day, basket number 18, is Gail Silver. Congrats, Gail. The winner of basket number 19, Museum Mania, is John Guido. Congrats, John. The winner of basket number 20, Teen Boy Survival Kit, is Sister Mary Kelly. The winner of basket number 21 for the Foodie Techie is Kim Woo. For the winner of basket number 23, Taste of the Town, is Barbara DeMarco. And last but not least, the winner of basket number 23, Mom's Day Off, is Salvatore Ferrera. That concludes the raffle portion of our virtual event. Congratulations to all the winners and who will be contacted following this presentation. Thank you all for attending our virtual Brunch for a Cause. Now let's bring it back to our Foundation President, Kim Kranz, with the closing remarks.
I sure hope you enjoyed TJ, our illusionist, and I want to thank each and every one of you for being here at our virtual brunch. And we will make sure that anyone who has won a raffle, that we will be in touch with you. But I want to say, if you should need anything from Good Shepherd Hospice in the future, please do not hesitate to reach out to us and give us a call. I think sometimes people are afraid of hospice and unfortunately use us when sometimes they could have used us a little bit sooner. So many families say, I wish I knew about you sooner. So if there's anything we can do to help support you, to help support a friend or a neighbor, and again, we want to thank you for joining us today. Thank you for your support in helping us continue our mission and our ministry to serve our community. I hope you have a wonderful rest of the day. Thank you.